All right. Hello, everybody. It's that time. I'm going to do it earlier this week with the numbers the way they're looking. I'm going to probably be doing the updates every week to 10 days now instead of just every other Friday like I was. I'm going to do it earlier this week because of the upcoming holiday. I want to get it over with and out of the way. Our numbers are climbing. It's time to take notice, even more than we were before. It's time to sound the alarm. We need to start thinking. We need to start doing what we did back in March, April, May, to lower that curve, which we all did. Our numbers grew, and we got them go back down. Well, ladies and gentlemen, we are at a number right now that I believe may be its highest point since the start, if not close. County-wide confirmed cases are 10,405 since the start. Active cases as of tonight, when I checked the county website to do the update for you, 1,657 active cases. 103 are in the hospital. Unfortunately, 215 fatalities due to the COVID-19 virus. And in our town of Dover, we are now up to a number of 52 active cases. Thursday into Friday morning, I was advised we went from 19 to 41. Then throughout the weekend, we went down a little bit into the upper 30s. We stayed there. And tonight, when I came home to prepare for this, we are now at 52 active cases. We need to start thinking about that. Over 74% of the cases countywide are tracing back to small and large types of gatherings. We knew this would happen. Holiday season, Black Friday, Hanukkah, going into Christmas this week. We know people are get together. Families, friends, neighbors, people we trust, but we don't know. We all go somewhere. We don't know what we're bringing. We have to be careful. I've said all along, we're all guilty of forgetting a mask or not spraying or sanitizing our hands. We're all guilty of it. We are all guilty of it, one way or another. We need to start thinking. At this point in time, there are no microcluster zones designated in Dutchess County, but Dutchess County's numbers are going up. Dutchess County's infection rate right now is 6.33% over the last 7-day rolling average. The state updates, there is no major indoor dining capacity changes statewide, just in New York City. Gyms, barbershops, hair salons will not be required to close in zones. However, gyms will reduce capacity to 25%, and personal care services can remain open with weekly staff testing, regular testing. The state and related metrics continue to focus on hospital capacity. That is a worry, and are encouraging hospitals to continue to expand bed capacity. Once again, like in the beginning, the state has called on retired nurses and doctors to come and lend a hand for when it does climb to the point where they are overwhelmed or they're starting to feel overwhelmed. Hospitals are expected to stay below 85% capacity by adding beds. There is a vaccine update. The first doses were given in Dutchess County last week. Vaccines to nursing homes in Dutchess County begins this week. All 13 homes in the county are scheduled for vaccines between now and the year end for its initial dose. Governor Cuomo has established regional vaccine hubs. They will be led by local hospital systems. These hubs will work with community leaders to develop a regional vaccine network, which will guide vaccine administrations once enough doses are in hand to commence the next phase of the state's vaccination administration plan in early 2021. New York State Department of Financial Services directed New York State health insurers to immediately cover, without cost sharing, approved COVID-19 immunizations and their administrations. So, vaccines are here. Vaccines will be by choice. There will be a plan. There will be a certain way it will be administered. and that will be handed down by the state. Certain things will get them first. We've heard front lines, nursing homes, whatever the state sends down, that's the way it will be administered out. At this time, as of yesterday, in our countywide supervisors and mayors conference call with the executive and his staff, hospitals don't feel overwhelmed at this point, but if the rate continues at the pace that it is, they will become overwhelmed soon down the road. Eastern Dutchess County residents, we cannot, it doesn't look like we can't go to the Connecticut hospitals to get the vaccination. It has to be administered in New York State because you are a New York State resident. Due to the numbers, the county has slowed down on some of their offices. You'll see possibility of certain offices that are half staff. I know in my building at the highway, administration staff upstairs are 1 day on, 1 day off to stagger the staff in and out. Our shop, they're putting our mechanics out on the road more instead of bringing everything back in to try to keep the number of people together at a low number. But along with that, even though the numbers are changing and going upwards, as of yesterday, Monday, Marcus Molinaro felt that there were no big changes at this point in time coming from Albany. We all feel we're going to see what happens after the holiday this weekend next. The numbers are climbing because why? Because Thanksgiving, Black Friday, shopping, Hanukkah, families getting together leading into Christmas this weekend, and then next week into New Year's. Those initial holiday season days, the Thanksgiving and the Black Fridays, are all proving to be catching up to us now. Again, it's over 74% through tracing, background checking, questions being answered from those who come down positive. It's all leading back to a small or large type of gathering, a form of gathering. So we need to keep that in mind. I'm not going to drag this on. We know what we need to do. I want each and every one of you to understand. We're not forcing, we're asking. We're not forcing anything, we're recommending. We ask you to listen to what is being said in the directives, listen to the recommendations that are being handed down from both the state, the county, and your town. We follow the directives that are sent to us. We ask you to please think about it, please listen, please be smart, and please be safe. So with that, I want to wish each and every one of you a very Merry Christmas this coming weekend. Be smart and be safe, and when you are gathering, sit apart, social distance yourselves. If you have a large group, it's not wrong to wear masks now. If you have to be safer, if you want to be with your family, wear the mask. Enjoy yourselves, have a very Merry Christmas, and always remember, we are Dover, we are strong. We are Dover strong, and we all plan on being that way and remaining that way until the end. We are one team. We are one town. We are the town of Dover. And I have said it. We have all said it. Here at the town hall, we will all get through this together. We will do what we need to do to get through it. We will bring you the information that we need to bring you. We will give you anything that it comes to us. It will be given to you. Information, directives, safety protocols, whatever it may be. Ladies and gentlemen, Merry Christmas to you all. Be well, be safe, and most of all, please try to stay healthy. And God bless. And remember, #DoverStrong. Merry Christmas, everybody. Good night.